my, we're
Hey,
upside down.
well,
There
there
you
you go.
are. How
How
are
you doing,
you?
Michelle? Good to see you.
There we go. Now I can hear you and I can see you. So Michelle, take three. How are you, Dr. Steve?
I'm doing great. How are you this evening, Michelle?
I'm good. I'm way out of my comfort zone here. If I put my hands out, like I'm shaking like a leaf, but we, I want to provide information to everybody on this. So got to get out of the comfort zone and do it, right?
Absolutely. That's where success takes place. That's where growth occurs, right? By getting out of that comfort zone, and you do it very well. So,
Oh, well,
congratulations.
thank you. Thank you. So I just wanted to provide some help or some information to other members. So I have talked on my first live that I missed, my take one, that you were with Zingular for a few years. So if you could tell us a little bit more about when you joined and the reason that you joined.
Sure. Well, first, I'll tell everyone who I am. My name is Dr. Steve Ralston. I am a chiropractor, a wellness practitioner. I've been practicing this year's 20 years now. And, when I was first introduced to this system, I was introduced to this system 10 and a half years ago. And when I was first introduced to this, it's funny because I was looking for something. I was looking for a way to help more people outside the office. We've known for many, many years now, we've had an epidemic going on in America, in the States, in Canada, really around the world, obesity epidemic. And you've seen a lot of people struggles. I know down here in the States, we got upwards of 70% of our adult population who is overweight. They had stated a few years back that they thought they seen a rise in even in the children.
Yeah.
Or increase in obesity with them as well. Of course, when that happens, of course, our life expectancy may start to go down as well. And they had mentioned a few years back that they had stated that our children's life expectancy was now less than ours, which is a scary thing when you think about it, right?
Really?
So, so I knew people needed help, and the thing is, there's so many conditions that are related to obesity, right? So, whereas when I looked at this system, I saw the ingredients. I saw there are whole food based, naturally sourced ingredients. I saw the results that people were getting as far as the weight loss is concerned. But the thing was, Michelle, being a wellness practitioner, what really piqued my interest is not just the visual transformation that occurred, but not only were they looking better, but they were feeling better and they were living
Yeah.
better. And really, when you think about it, Michelle, isn't that what it's all about? Life's supposed to be a beautiful journey for us, right? And
Yeah.
and we should be feeling better. And the idea is, as we get older, we want to continue. We want to live as long as we possibly can. But then when we do pass on, we want to still feel young, right? So, whereas with this system, when we share our stories, when we share the products with others, we do not make any claims of diagnosing, treating, or curing any conditions. But of course, I'm a
No.
firm believer that if you feed your body the right nutrients at the right time, the body is capable of thriving. The body is capable of you being able to reach your optimal level as far as your health potential is concerned. So I got started with this. Now, I don't have a weight loss story to share. I've always been a thin individual, and I work out on a regular basis. Unfortunately, I had some digestive issues that I dealt with for over 20 years. But as time went on, being a chiropractor, a wellness practitioner, you beat the body up,
Yeah.
and so with excess weight on the body, when you have excess fat on the body, it increases inflammation in the body. And it was starting to be difficult to take care of my patients, adjust my patients, because I developed joint pain and shoulder pain, really is what it was. And it was tough to take care of my patients. So when there's excess weight on the body, that puts increased stress on your joints. Of course, we do know that, for every pound of extra weight on the body puts 4 pounds of pressure on the knees. It could put
Yeah.
up to 9 to 10 pounds of pressure on the hips, So when that occurs, can you imagine if someone has 10 extra pounds in the body, that's an extra 40 pounds of stress on their knees alone, you know?
Yeah.
So, so we knew this, you know, for many years, we knew it put a lot of stress on the body. So, I wanted to help more people. So that's why I got involved with this. And I had low energy. It was a struggle to get through my workday. So I got started. I needed to know two things, being a wellness practitioner. One, is the system safe? Two, is it actually effective? Because if it's not safe, it's not effective, then there's no way I'm going to suggest or recommend anyone to even try this system, because I wasn't about to put my credibility on the line like that. But the only way for me to find that out is just to try the system out myself. And I got to say, I was pleasantly surprised, because, you know, with the digestive issues that I've had, I had a lot of bloating that went on in my stomach area that I could not get rid of. And I changed my diet, modified my diet many times over. I worked my butt off in the gym trying to get that stomach, that gut to go down, and it just would not budge. But it wasn't until I started this system and things started to change for me. You know, the stomach just went way down. I started to feel so much better. My digestion started to, didn't really have any digestive issues after that. Again, we don't make any claims of, you know, treating any of those conditions, but I'm a firm believer, feed your body the nutrients, adopt a healthier lifestyle. You're going to function that much better. And that's what really started to take place with me. My joints started feeling better. My energy level is up. And the thing is, you know, I'm going to be 50 in a few weeks, and I'm doing things in the gym now that I could not even do when I was in my 20s, which just blows my mind. You know what I mean? And, you know, I got to say, for me, the only regret that I ever have about this is that it wasn't introduced to me sooner. And that's something that I hear from people over and over again. And I feel the same exact way, because I got to tell you, it would have saved me a lot of years of grief. It really would have.
Same here. Yeah.
So it's been an incredible journey for me to be able to, you know, see the changes that occurred, not only in myself, but not only am I feeling better, but I'm able to share this with other people. And I'm able to help so many other people feel just as good as I do. And that's really what it's all about. You know, it's about looking better, feeling better, living better. And we should all be able to thrive as far as our health is concerned. And that's really what it's all about. And that's why we continue to share with other people.
So I'm of course, the same happened with me. I joined for the weight loss. I lost 19 pounds. I lost 19 inches. I gained a little bit back, and then I dropped it off again. So it's, you know, it depends on what's happening that month or whatever. And but what I soon realized after I joined is I started using all these other supplements that I didn't know about. And I'm celebrating the first year of, and let's be careful here so I don't say the wrong word, but the first year that I'm discomfort free, we'll say, in my joints. And that was 28 years of discomfort that I had, that I'm able now to have a much different life, be able to be active like I wasn't before, and that was using certain products. So I have talked about the products, I've done lives about the products, but you're a lot more of an expert on the products. So are you able to maybe give a short description on Flex and what it does to your body, and osteo also, because those are two of the products that really helped me, along with Global Blend, of course.
Right. Yeah. Yes. And I do know that, because you and I have, you know, messaged back and forth about that, how it's helped you. And I'm so thankful, you know,
it's
that
incredible.
You're a part of this and you're feeling so much better. So those two products right there, Flex and Osteo, I mean, here's one thing we know, and this is what I've taught my patients for many, many years. Our joints should be mobile, right? As far as exercise is concerned, there's three key areas you always want to focus on. One is cardiovascular, right? You got to make sure you exercise the most important muscle in your body is the heart. But two is you have to do some resistance training as well. Number one indicator for aging is loss of muscle mass. Okay, so if we're losing muscle, it's a sign that we're aging. But the three is mobility or flexibility. Our joints should be a little bit flexible. You know, as we get older, unfortunately, you know, for some of us, you know, a lot of us, our joints start to stiffen up and they start to ache and they start to wear down. Okay, um, so what's great about osteo and flex helps the joints, okay, and it helps to lubricate the joints, and it's supplying the nutrients into the cartilage in the joints as well, and to make it more pliable and make it a little bit more flexible for you. Whereas the osteo helps to rebuild the bones, okay, make the bones a little bit stronger. You want the bones to be dense. As we get older, roughly around the age of 30, 35, we start losing bone mass, bone density, so for some. And not only that, but we start to lose our strength and muscle mass. So we want to feed our body the nutrients to be able to hold on to that as long as we possibly can. So the idea with the flex, the idea with the osteo is to feed the body the nutrients, the joints, the bones. We want the bones to be strong to withstand the weight of the body. Okay, and as some people get older, what do we find? It's easier for them to injure their bones, to fracture their bones. We hear as they get older, maybe they have a hip fracture or something like that. So we want to continuously feed our body the proper nutrients, and we can have the best diet that we can possibly follow, but we need to supplement. We have to feed some extra nutrients to the body, and I truly believe that's where the flex and the osteo comes into play as far as the joints are concerned. You know, and they make a
Yeah.
huge difference. As far as the global is concerned, well, that's terrific too. I mean, it helps bring
Jesus
down the,
juice.
yeah, it helps bring down the inflammation in the
Yeah.
body, balancing out the hormones, and it's loaded with antioxidants to help fight free radical damage, to help prevent oxidation in the body as well. And there's so many benefits to it. So I'm a firm believer that everyone would benefit with being on, I don't care what your age is, everyone would benefit with you know, taking global on a regular basis. As we get older, flex and osteo, huge, powerful
Huge.
products to take. Yeah, absolutely.
So I've noticed how good these products are because I ended up running out for a few weeks.
Oh,
Twice. I did the first time and I said, no, I'm not going to run out ever again. And, you know, things happen. You forget to order or whatever. And I ran out twice and I swear this is the last time. What a difference I saw in my mobility. I was literally walking and you could hear my hip
oh
make a
wow.
noise, and I thought, oh good God, it's gonna fall apart pretty soon. You know? I'm a bit older than you. I'm not 60 yet, but I'm getting there. So I thought, wow, I really need to do this before you know something breaks down type of thing. But and the global blend, same thing there. Like I ran out of that, and it's just it just makes you feel super good all like everywhere. It's not like you say, we're not we don't guarantee things, and we're not doctors, and we can't commit to anything. But like if I was to stop taking that global blend, I'm a little bit afraid of what I might look like within a week or so. Same with the flex and the osteo. It's made such an impact on my life. It like that it's 28 years of discomfort. So I wanted somebody else to come on here and vouch for what I had been saying, just in case, you know, they didn't believe me. Surely they would believe you, Dr. Steve. So that was the reason why I wanted to do this. How long have you been using Zingular?
10 and a half years now. You know,
Wow.
and by the way, I didn't mention, but my first 8 days when I got started, I did lose weight. I lost 9 pounds and 6 inches. Most of those inches were from the abdominal area. So I had, you know, everyone has a six pack in their
Yeah.
stomach area. You know, unfortunately, some of us have it covered up with a blanket or two or something like that. And I had that, and I had that bloat going on as well, that pouch, and it just went way down. What I like about our system is we really focus on the core area. You know, 70% of the immune system is localized in our intestines, so we work on cleansing that out. So,
Yeah.
and I know that's very important. And seeing the changes that occurred in myself, that's why I'll continue to use this system for the rest of my life, because I know I feel so much better, and that's why I'll continue to share it with others. But the past 10.5 years, I've been using it, and it's been a godsend for me.
Wow. So I'm on a year, so hopefully I'll be able to hit that 10-year mark and feel way better. Like I'm on a roll. So I'm just hoping that I'm able to not convince, but to share with other people. I mean, I have so many friends that are construction workers, many that are gym goers, and they all have, well, the construction guys all have the same not complaint, but the same. Um, their shoulders, the mobility. Somebody that does a lot of painting, it's always the same range of motion. Their knees, because they work a lot of the times it's on cement. Cement floors are very hard on your knees. So
Absolutely.
my point is for them to know about this. They can keep working and they don't have to be in such discomfort all the time, because it's a tough job, and you want to feel good when you're doing it. And same with the gym goers. I mean, they experience discomforts also. I don't go at the gym, but I've heard. So I have a lot of friends that do go at the gym. So if I can help them, have a better workout, or fix some issues, or maybe that's non-compliant here, but um, help resolve some issues, we'll say, with their bones and their motion, then that's why I wanted to come on here.
Well, that's terrific. And once again, the idea is to thrive, right? So again, feeding the body the nutrients for you to reach your optimal level as far as your health potential is concerned is really, I think, an important thing here. And again, yes, we do not treat any conditions, or you can't focus on those conditions. The only thing you can do is focus on getting yourself to be the healthiest you could possibly be. And once you do that, keep that as your main focus,
Yeah.
everything else starts to be a little bit better to deal with. You know what I mean?
Yeah.
And you start to feel better. You start to feel younger. Your energy level is up. And I got to tell you, your before and after picture is incredible. And I think you just look amazing. And I'm so
Thank
glad that
you.
you're feeling so much better now. And I appreciate everything you do, having the passion that you have to want to be able to share this with other people. Because I know for me, it's just once you start seeing a change in yourself and you feel so much better, what do you want to do? Sometimes you just want to shout it out at the rooftops. You know what I mean?
Exactly, exactly. And yes, if you feel good, you want everybody to feel good. And if somebody's feeling bad, well, you just want to say, hey, try this. It's gonna help. So that is my goal. I'm gonna keep doing it, and I'm gonna keep sharing, because feeling good is awesome, and we all need to feel good, right?
Absolutely. That's what it's all about. So I want to thank you for allowing me to hop on and share this. And once again, thank you for everything you do. I know, you have such a passion to be able to want to help so many other people, and just, never let that flame go out.
I won't. And thank you for taking the time out of your busy schedule to explain some of these products, and how it affected you, so I could share this with my many friends.
Oh, it's my
So
pleasure, Michelle.
I thank you again, and you have a great evening, Dr. Steve.
Thank you. I will, Michelle. You do the same. Take care.
Thank you. Bye.